Hey everybody, I am Dr. Jonathan Abenheim. I'm a double board certified implantologist. I am now sharing you one of my cases that involved all of the parts from my patents, the THS parts, the Powerball screw, and my full XCELL workflow. If you watch, you may learn. Okay, here we go, another iteration of an XCELL surgery. This is our patient. He is fully edentulous. I'm just checking the setup to make sure that it's correct, and then we go ahead and we get him nice and numb. He is under sedation right now. We do some nice infiltration, and then we go ahead and we put our new product, which is PowerFoam X, which is coming out soon. We go ahead and make the osteotomy for the Power Tack screw, which comes in 5 different sizes. You can go ahead and purchase that on our website, thepowerballscrew.com. And we take our shining scanner and we do our pre-op scan. Make sure we have the Power Tack in position. You only need one because of its 3-dimensional. Now we go ahead and use a copy of the wax up to let me know the extent of what my incision should be, where the distal of the molar is going to be. We use an electrosurge. Make a small little vertical incision on the crest. Make sure he's nice and numb because I really feel it when it comes to these things. And yeah, we come all the way around real quick. You can see how it's nice and clean. Make a small little releasing in the middle because we're going to reflect and we are going to retract some bone. We redo the incision with a knife to make sure we're down to the bone level. And then we go ahead and we peel off the tissue from the bone. The patient doesn't feel a thing. And we expose the bone. I like to only lift the flap to how much bone I'm going to reduce. I don't like to lift it all the way up because it causes the patient to have more pain. I already measured before. It's about 5 millimeters of alveoplasty. PowerFoam X goes in. And I make my first cut with a cross-fluted carbide burr. Goes right through, beautiful, nice and strong. Sometimes I go through till I hit the retractor, but in this case I just went 3/4 of the way there. And then we use our bone ronger to just remove that area. Now the first part of the bone is removed. We see here that the sinus is now exposed. Because it is now exposed, and we go to clean out the lingual part to make sure we don't perforate it. And then we start with our first osteotomy, right anterior to that area of the sinus. We use densiburs so that even if we're touching the wall of the sinus, we can still densify the bone. And still get good torque. Final burr with the Syn kit. Here comes the Versalis implant. You can see it goes in really fast. This is 80 newtons of torque right there. Really grabs unbelievable torque. And then we do the final placement. Does not get stuck or anything like that. Goes in really beautifully. Then we go anterior to that. Do our next osteotomy. We feel the bone. We decide where we're at. Drill down to depth. And we go to Versalis again. You can see it goes 75% of the way in at 80 Newton centimeters. And then we do the final torque through there. The multi-units, the angled multi-units are beautiful because of its contour, its shape. You don't have to remove the bone to get it to seat. We try to use straight ones as much as we can because the Powerball screw can change the angle up to 30 degrees. And we have those 2 implants placed. We switch the bite block. We find the boundary of my incision down to the first molar. And we go and we lift again. By doing it in quadrants, it allows me to have now a landmark of how much reduction I need to do. I just need to match the left side to the right side. Again, the reduction was done in this case because of the transition line, and we wanted to be able to hide it all. Retract slightly in the palatal. We don't open massive flaps. And we remove this so that if we're close to the sinus, we don't perforate the sinus. We now look where we're going to reapproximate the tissues. We smooth everything out with a bone reduction burr. Again, only open what we need. We find the wall of the sinus. We're still in good bone, and we're drilling about 30 degrees. And then we go to densa in case we lose our trajectory. We're still in reverse so that we're pushing the bone to the side of the sinus. We go to the final sin drill. And then we go to versalis. See 80 Newton centimeters of torque again, and it goes in really quickly. All right, now we split the middle. We drill for 2 more implants. We feel the density of the bone so that we know where everything is supposed to be. Look how great the power foam is working. I'm excited to bring that to you. Again, 80 Newton centimeters. Again, 80 Newton centimeters. And then we final torque. We go to 1 millimeter subcrestal with these. All right, place a 30-degree multi-unit, goes in like butter, and then we go to straight. We torque those into 25, and then again to straight right there. We make sure we have enough reduction based on our setup. Now we realize that his sinus is a little bit too anterior, so we're going to crush it up by grafting for the future right behind that implant, and then we're going to do a crestal lift posterior to that after we do slight reduction. And we're going to use densiburs for that. We go till we feel the floor of the sinus. We go in reverse to the 3.0. I'm at about 5 or 6 millimeters right now. We use Nova bone, and then we go in reverse to push the bone up. You can see as I penetrate through the sinus, Nova goes through, and now full of bone. I fill it in the crush area and in the crestal area, and then go ahead and place a versalis, and you can see we have over 80 Newton centimeters of torque. Go a little bit deeper so that we don't run out of any running room, and again straight multi-unit right there. So now we have a total of 6 implants. Torque that to 25 Newton centimeters. Then we go ahead and put a photogrammetry flags 2PAL 3D. I love these. They're really easy to put on, and they can be captured from any direction: front, back, top, bottom, sideways, palatal, and boom, the scan is done. And now we're going to try and use the palatal tissue as much as possible to cover our multi-units, because it's nice thick tissue that doesn't move. And the way we do that is we use a small tissue punch, and then we use the THS caps. You can see, look closely how it just tacks the tissue in. And it's almost like this is going to keep where the tissue is going to be, and the sutures just do very minimal. This allows us to design our prosthesis the same day in the correct position so that the tissue doesn't go anywhere. And now you can see without any sutures, the tissue is exactly where it's supposed to be. We're going to have great keratinized tissue. This is the 2 millimeter THS. You can tell by the gold. They come in 1, 2, 3, and 4, again, at thepowerballscrew.com. You should definitely get these. They're in all the libraries for photogrammetry or exocad or 3Shape, and they're unbelievable when it comes to full arch. This is 4O chromic. I still use nice thin suture, not too ochromic, so that I don't get any scar tissue after, and it heals uneventfully. Again, another 2mm THS. We put these to 5 to 10 Newton centimeters, and look already how there's almost no blood, because the THS creates hemostasis by pressing on the part that bleeds the most, which is right where the incisions lines are. We do nice small interrupted stitches so that nothing will rip. We close the vertical before we go to the next side, because we have more than enough tissue. Go through the palette again. Place our THS 2mm right through. It self-aligns itself onto the multi-unit. And we continue the suturing. The key to this success is to make sure you have as much tissue and as much thickness of it as possible. Try not to cut any of the tissue you have away. Just reposition it where it's supposed to be. Because if you remove it, you're going to wish you had it in the future. All right, some more THS. I was able to use all the same sizes, 2mm here. And now we suture around there. Power foam is making sure that I don't lose anything. I'm putting a collagen membrane on the sinus crush. And then we go ahead and suture it. By the sinus, I'm a little bit more meticulous in terms of my closure, because I don't want to have any communication whatsoever or any spontaneous opening. But in general, it looks great. Go ahead, do our final soft tissue scan. I go ahead and I design the exocad design. I print it with a Dentifab scanner, and then boom, we deliver it with Powerball 1.0 screws. You can see when we design it, we actually create pressure on the tissue to also create hemostasis, but the THS is what really sets us up for that. And obviously the fit is perfect. And the bite is also perfect. And now we are done. And this is how you do a full arch case. Really easy, really quickly, with a lot of fun. That's it. Hope you guys enjoyed it.